Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Jenna Kreger. Coming up in this episode, if joint pain is slowing you down, doctors want you to know when a procedure may be your best option and how to choose your surgeon. A local specialist explains how a minimally invasive procedure helps alleviate pain from a common condition in the colon. And stay tuned to learn about Pap screenings. It's a quick test that can help save women's lives. First, have you ever had a headache that is so debilitating you can barely function? Specialists say migraines are common in adults and children, and a new study points to vitamin deficiencies as a possible cause.
New information is available on migraine headaches. Now we understand this as a condition where the brain is hyperexcitable. And then we know women are more vulnerable to migraine as opposed to men. Once the headache is triggered, so then there is an electrical pulse goes through your brain, and then the nerve endings in your brain releases chemicals. These chemicals react with the blood vessels in the brain. First the blood vessels go through a constriction, then they kind of dilate and pound. That's when you have a bad headache. Talk about billions of dollars lost in productivity because people are calling out from work. Anybody who had a relative or a mom or a sister who had a migraine headache can easily identify with that because they can't do anything. All they had to do is go into a dark room, close the door, and lay there for a whole day. So they can't take care of any of their needs or the family's needs. So it's very debilitating headache.
A migraine can be so intense that it keeps a student home from school. Dr. Sam, as he likes to be called, says certain vitamins are linked to these serious headaches.
There are very effective prescription medications. You can take it to prevent the headache from coming back. And there are also some vitamins that are very helpful. I always recommend my patients take riboflavin, which is vitamin B2, and I tell them to take magnesium, which is a good way of decreasing the brain's excitability. And then CoQ10 is also another good medication or vitamin to take to reduce the frequency of migraine headaches. There's a recent study that looked at patients with chronic and episodic migraines. They noted that patients who had chronic migraine had low riboflavin and a low CoQ10. So there is some scientific evidence to support the supplement of these vitamins and minerals.
Dr. Sam also said migraine sufferers can make lifestyle changes to reduce those episodes.
For example, you have to make sure that you get good rest. If you have a chaotic schedule, migraine does not like chaos. So you have to make sure that you sleep, especially go to bed at the same time at night and wake up at the same time in the morning. Many people will, on weekdays, will wake up at 6 o'clock in the morning to go to work, and then they sleep until 11 on the weekends. If you're a migraineur, that's a bad thing for you. That will trigger a headache. And same thing, you have to eat on time. You cannot go hungry because if your eating schedule is chaotic, that could trigger a headache.
If you'd like to find a specialist who can help you with migraine headaches, visit the website on your screen. Next, imagine feeling excruciating pain or discomfort anytime after eating. This is the reality for many people who suffer from a condition of the colon that develops over time. Relief is now available with a minimally invasive procedure.
The colon is an organ that contains and passes stool as well as absorb water as part of the digestive system. Unfortunately, what happens is that over time with age, the colon tends to get little pockets that forms, and these are called diverticulosis. Diverticulosis themselves are not a problem, but when a piece of stool or fecal matter get caught in the pocket and then it gets infected, then we call it diverticulitis, and that's when those patients have the symptoms of pain and bloating and constipation or diarrhea.
The pain started slowly, kind of in the evening after eating dinner. The pain was just minor. I kind of ignored it, thought it would go away. By the evening, 6 or 7 o'clock later that evening, the pain was really bad. I ignored it at first. The pain got to the point where I couldn't ignore it anymore and I had to go to the emergency room.
Dr. Tran determined that Todd Wardingley would be a good candidate for a laparoscopic colon resection procedure.
able to keep the incision very small, and so the patients actually do go home earlier. We use very, very high definition fiber optic camera and small instruments, as well as very high-tech staplers to divide, resect the colon, and connect it all together in one setting where the patient doesn't have to have a colostomy. The patient ends up staying in the hospital for about 3 to 5 days, which is a remarkable difference than when they had it in the past, where they stay usually 7 or 8 days. And here at Florida Hospital, Waterman, we actually come up with a protocol where we actually give the patient a clear nutrient supplement the night before. We give them 1 dose of antibiotics. We follow a very strict regimen of getting them out of bed early oral intake, early ambulation, and they get to go home much, much quicker.
Dr. Tran explained to me and showed me on video that it was just a small section, about 1 foot long, of the intestines that he would have to remove. 3 small incisions, and he was going to be complete with the surgery. I'm really glad that I had surgery. Before having the surgery, I was concerned with what I ate. Would the pain come back? Would there be any inflammation? But after the surgery, I haven't had to worry about if the pain was going to come back.
You can find a specialist to discuss whether you or a loved one might be a candidate for minimally invasive treatment by visiting the website on your screen. In our next story, a local specialist wants the women watching to know more about a common and quick test that can help identify cervical cancer.
Pap screening, we probably can change to, instead of saying a pap smear, we'll say a thin prep, because the testing is a little bit different now than it was a long time ago. We check the cells on the cervix, and we also check for the HPV virus, which is human papilloma virus, because we know that the human papilloma virus is the virus that causes up to 99% of cervical cancer. Sometimes you can find where there's mild changes, and it could be atypical squamous cells of undetermined significance. Again, you want to check for the HPV virus. It may or may not be there. Then there's low-grade squamous intraepithelial lesion. Again, this just means mild changes, but we know that the HPV virus is associated with these mild changes. So if we get the results of the mild changes, those we normally just repeat your pap test in 6 months, because the body can clear this virus if you have a very good immune system. So I encourage all my patients to make sure they're eating healthy, make sure they're taking their vitamin C's.
Dr. Main credits the pap test with having tremendous success in helping to save lives.
In the developed countries, cervical cancer is not as common, but it's still one of the leading causes of gynecological cancers in the third world countries. And that's because we're doing more pap tests, we're finding all these abnormal cells, and we're treating them before they even become cancerous.
If you'd like to find a specialist to speak with about risks for gynecological cancers, visit the website fhwatermanwomens.com. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. If soup in the summertime just seems wrong, you'll want to stay tuned. Chef Fred and Mara will share a tasty soup recipe that's cool and delicious. Are sports on the horizon for your student? If so, a Tavares pediatrician has important information to know before the start of the school year. If you or a loved one is considering surgery to alleviate joint pain, you'll want to hear why having it done close to home is best. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. First, here are upcoming events you or a loved one might want to attend. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Jenna Kreger. Joint pain can often cause people to stop exercising. In fact, sometimes any activity can be excruciating. For years, doctors have tried surgery to alleviate the pain. Now local specialists want you to know that the procedures of the past are much different than today's.
Joint replacements, they've evolved quite a bit, even pain control. 20 years ago, 25 years ago when I really started doing this stuff, it was really, patients had to just suck it up. You can only give people so much pain medication, but just the pain control methods we use nowadays are phenomenal compared to what they were even 5 years ago. Now with our knee replacements, partial knee replacements, we do these femoral nerve catheters where the anesthesiologist puts this little catheter over the big nerve that goes into their thigh that supplies pain to their knee, and we're able to quite often completely eliminate the pain, the post-op pain, those first 48 hours.
Dr. Radnothy also attributes the improvements in patient outcomes to minimally invasive approaches, which are more available to patients.
Minimally invasive is a response to the need to cut down in the healthcare costs. But what's driven minimally invasive surgery is the need to get patients out of the hospital quicker. And it's interesting because looking back at it now, it's completely common sense.
Dr. Radnothy says it's important for patients and their families to know what to expect when considering whether to have a procedure.
Knowledge is power. And historically in my own practice, I have always gone to great lengths to explain to patients, okay, this is what you can expect when you go in the day of surgery. This is what's going to happen during surgery. This is what's going to happen the first day after surgery, the second day. This is what's going to happen when you go home. Now, number one, it's the physicians in the facility. Bedside manner. Does your doctor, does he sit down and talk to you? Can he talk to you? Is he capable of talking to you? Can he sit down like a small town physician in the old days and actually look you in the eye and listen to you and find out what's going on and give you really good bedside manner communication? I think that's key. You get that with any of us surgeons here. The perception that small town medicine surgery is not as good as the big city surgery, or the southern care is not as good as the doctors up north, it's not true, not true at all. I've got patients personally that have come literally from all over the world to come to Lake County, Florida, Florida Hospital Waterman, to have me do their knee replacements.
Don Roberts of Bellevue was amazed by how much partial knee replacement surgery changed her quality of life.
I moved here from Ohio in 2010, and my knees were really bad. I couldn't walk too good. I was having problems with arthritis and just pain, a lot of pain. After the surgery was over, I went through some of the therapy. The difference just after the surgery was incredible, let alone the therapy. Dr. Radnothy, if I had to have these procedures done, he's the doctor to have it done with. He is superb.
If you or a loved one suffers from joint pain, visit the website fhwatermanortho.com to learn more about treatments that can provide relief. It may be the middle of summer, but already families throughout Lake County are thinking about the start of the new school year. Encouraging students to become involved with sports is one important school-related activity to consider and prepare for.
One of the guidelines for healthy behavior in children is making sure that children get enough exercise per day. So for healthy behavior, we recommend at least 1 hour of exercise per day. I always tell parents that exercise is medicine. Exercise is the best way to prevent chronic disease. And also, sports participation is important for the mental health of the child. A child that participates in sports learns how to participate on a team, be a team leader, learns how to accept winning and defeat, which is an important life lesson.
Before students can participate in school sports, they will need to undergo a sports physical exam.
A sports physical is actually good for 365 days. So whenever the child comes in for his annual well exam, if they are planning on participating in sports, which I strongly encourage, we will ask them if they need that, and then we'll fill out the physical form at that time. So they do not need to come in separately for that. And we actually prefer to do their sports physical with their well exam rather than they go to a gym in a high school and have an assembly line sports physical done, because in my office their physical is of course going to be more comprehensive.
Dr. Thomas is so passionate about the importance of sports and exercise, she has a second job as the team physician for the Lake Sumter State College athletics program.
When my children were younger, they played baseball and they went to many a summer camp at Lake Sumter, and I enjoyed that and I enjoyed watching sports, so I volunteered, it's been about 11 years ago now, to act as the team physician for the Lake Sumter athletes. Most of these students are 18 or 19 when they enter college, and if they're away from home, they don't have a physician. So I take, if they're sick, they call me and I take care of the things that their pediatrician at home would have taken care of.
You can find a pediatrician who can help your family prepare for back to school by visiting the website fhwaterman.com. Next, we visit the Conry Creation Health Center kitchen, where Caroline Rowland and the Florida Hospital Waterman team are making a meal with the push of a button.
With the temperatures heating up, you might be looking to cool down, and we have a recipe chock full of some of your summertime favorites that will do just that for you. Right now, we're joined with Florida Hospital Waterman Executive Chef Fred Scherger. Fred, thanks for joining us, and registered dietitian Mara Gallo. Mara, tell me a little bit about what we're going to be making.
Today we're making a watermelon, tomato, and mango gazpacho, which is a nice cool version of a soup.
Okay, so Mara, we have a lot of fresh vegetables and fruits in this recipe. Can you tell me some of the health benefits of this?
Yeah, there's red vegetables, tomatoes, and red fruit, watermelon, and both of those provide good sources of lycopene, which is an antioxidant that helps prevent cancer and certain types of cardiac disease.
Great, so Chef Fred, we got a lot of ingredients that go in this one.
Yes, this nice cool summertime gazpacho has fresh diced mango, tomatoes, fresh diced cucumber, shallots, fresh watermelon, a little olive oil, fresh lemon juice, balsamic, fresh chopped cilantro, a pinch of salt, and a low-fat yogurt with cilantro mixed together that we're going to garnish this dish off. As we add the tomatoes, I'll add some fresh cucumbers, a little bit of fresh shallots together. It's a very quick and simple recipe that can just be put in the blender like so. A little bit of fresh lemon, and we'll top that off with some fresh chopped cilantro. You want to blend the gazpacho for about 15 to 20 seconds until you get a nice smooth consistency. Next, we want to take, as for our garnish, our low-fat yogurt, which is plain, and a little bit of cilantro, and we'll mix that together, and that's going to be a nice to kind of finish out, and with a little dollop of low-fat yogurt and fresh cilantro, the dish is complete.
If you'd like the tomato, watermelon, and mango gazpacho recipe, visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the August episode right here on Lake Sumter TV for some of the following stories. You'll learn how local specialists can help women who experience prolapse or a weakening of the pelvic muscles. Find out how a local hospital is able to help patients with lingering wounds heal faster. And we'll go back to the Conry Creation Health Center kitchen, where Chef Fred will show us a healthy, sweet, and delicious meal in a glass. It's perfect if you're always on the run. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Jenna Kreger for the award-winning Waterman Wellness.